Understanding egg binding. A gentle introduction. Egg binding is a common problem in female birds. It happens when a female bird cannot pass an egg. The egg gets stuck inside her body. This can be very painful and dangerous for the bird. Many different kinds of birds can experience egg binding. This includes pet birds like canaries, finches, budgies, and cockatiels. Even larger parrots can sometimes suffer from this condition. It is important for bird owners to understand what egg binding is. Knowing about it can help you protect your feathered friend from serious harm. Normally, when a female bird is ready to lay an egg, the process is smooth. The egg forms correctly. Her body has the strength to push it out. This happens naturally without any problems. However, with egg binding, something goes wrong in this process. The egg might be too large, or the bird's body might be too weak to expel it. The egg then remains lodged in her reproductive tract. This situation is not normal and requires attention. It is a specific type of dystocia, which means difficult birth, but for birds. Imagine a tiny bird trying to lay an egg. Her body works hard. The egg moves through a special tube called the oviduct. At the end of this journey, the egg should come out. But if the egg is stuck, it causes a blockage. This blockage can lead to many health issues very quickly. The bird will feel unwell and show signs of distress. It is a condition that can affect any egg-laying female, whether she has a mate or not. Female birds can produce eggs even without a male bird present. These eggs will just be infertile. Understanding egg binding is the first step to helping your bird. It is not just a minor discomfort. It is a serious medical condition. If you own a female bird, it is wise to learn about this issue. Knowing the causes and symptoms can make a big difference. Early recognition and prompt action can save your bird's life. This essay will guide you through what you need to know. We will explore why it happens and what you can do. Our goal is to keep our feathered companions healthy and happy for many years. Spotting the trouble signs of egg binding in your bird. Recognizing the signs of egg binding early is very important. Birds are good at hiding illness. This is a survival instinct from the wild, so you need to watch your bird closely. One of the first things you might notice is a change in her behavior. She might sit at the bottom of the cage. She may look tired and weak, not moving much. Her feathers might be fluffed up more than usual. She could also lose her appetite for food and water, which is always a concern for small creatures. You might see physical signs that point to egg binding. The bird may be straining as if trying to poop. Sometimes you can see a bulge or swelling near her vent. This is the area where eggs and droppings come out. Her abdomen might feel firm or look distended. She might have difficulty breathing. This can happen if the stuck egg presses on her air sacs. Observe her posture. She might sit with her legs splayed wide apart due to the discomfort and pressure from the retained egg. Changes in your bird's droppings can also be a clue. She might pass very large droppings, or she might not pass any droppings at all. Sometimes only watery urates, the white part of the dropping, are passed. If the egg is pressing on her intestines, it can block the passage of feces. Any significant change in the frequency, consistency, or appearance of her droppings warrants careful observation. It is essential to be familiar with your bird's normal dropping patterns to spot these deviations quickly. Other signs can include trembling or weakness in the legs. The bird might even seem partially paralyzed. This can happen if the egg is pressing on nerves that go to her legs. She might be reluctant to perch and may prefer to stay on a flat surface. She could also show signs of pain, like being more vocal or unusually quiet. If you see any of these signs, especially a combination of them, it is time to think about egg binding. Quick action is needed to help your bird. The root of the problem: nutritional shortfalls and egg binding. One of the most common causes of egg binding is poor nutrition. Calcium is a very important mineral for female birds laying eggs. It is needed to make strong eggshells. It is also vital for muscle contractions. The muscles in the oviduct need to contract to push the egg out. If a bird does not get enough calcium in her diet, her body cannot form a proper eggshell. The shell might be soft or poorly formed. Her muscles will also be weak and unable to expel the egg effectively. Vitamin D3 is another crucial nutrient linked to egg binding. Birds need vitamin D3 to absorb calcium from their food. Even if a bird eats enough calcium, she cannot use it without vitamin D3. Many pet birds are kept indoors. They do not get enough natural sunlight. Sunlight helps birds produce vitamin D3 in their bodies. So, an indoor bird might be deficient in this vitamin. This deficiency leads to poor calcium absorption. This in turn contributes to weak shells and weak muscles, increasing the risk of egg binding. Many pet birds are fed a diet mainly of seeds. Seed-based diets are often low in essential vitamins and minerals. They are particularly deficient in calcium, vitamin A, and other nutrients vital for reproductive health. A bird on a predominantly seed diet is at a much higher risk for egg binding. A balanced diet should include high-quality pellets. It should also have fresh vegetables and fruits. These provide a wider range of nutrients. Relying only on seeds is a common mistake that can have serious consequences for laying hens. Other nutritional imbalances can also play a role. For example, an excess of phosphorus in the diet can interfere with calcium absorption. Obesity, often caused by high-fat seed diets and lack of exercise, can also contribute. An overweight bird may have more difficulty passing an egg. It is essential for bird owners to understand the specific dietary needs of their bird species. Providing a complete and balanced diet is a cornerstone of preventing egg binding. Proper nutrition supports overall health and strong reproductive function. Beyond diet, other factors contributing to egg binding. While nutrition is key, other factors can also lead to egg binding. The age of the bird is one such factor. Very young birds laying for the first time may be at higher risk. Their reproductive systems may not be fully developed. Their bodies might not be ready for the strain of egg laying. Similarly, older birds can also face problems. As birds age, their muscles may weaken. They might have other underlying health issues that complicate egg laying. Chronic egg layers, those who lay too many eggs too frequently, also deplete their body's resources. Obesity is a significant problem for many pet birds. A bird that is overweight may have extra fat in her abdomen. This fat can narrow the passage for the egg. Obese birds are often less active. Their muscle tone can be poor. This makes it harder for them to push the egg out. Lack of exercise contributes to obesity. It also means the bird's muscles are not as strong as they should be. Providing ample space for flight and activity is important for maintaining a healthy weight and good muscle condition. Environmental stress can also trigger egg binding. Birds are sensitive creatures. Changes in their environment can cause stress. This could be a new cage, a new location, or the presence of other pets. Loud noises or a lack of privacy can also be stressful. If a bird feels unsafe or stressed, her body may not function properly. This can interfere with the normal egg-laying process. Providing a calm, stable, and secure environment is crucial. A proper nesting box, if you are breeding, should be available and feel safe to the hen. Previous reproductive problems can make a bird more prone to egg binding. If a bird has had egg binding before, she is more likely to experience it again. Some birds are chronic egg layers. They lay clutch after clutch of eggs without a break. This constant production depletes their bodies of vital nutrients. It also puts a continuous strain on their reproductive system. Sometimes an abnormally large or misshapen egg can cause a problem. Genetic factors can also play a role in some birds, predisposing them to difficulties with egg laying. Section 5. A serious situation. Why egg binding is a true emergency. Egg binding is not just a minor issue, it is a life-threatening emergency. When an egg is stuck, it puts immense pressure on the bird's internal organs. This pressure can interfere with blood circulation. It can also make it difficult for the bird to breathe. The bird's digestive system can also be affected. The stuck egg can press on the intestines, preventing the passage of droppings. This can lead to a buildup of waste products in the body, which is toxic. The bird can go into shock quickly from pain and physiological stress. One of the severe risks is that the stuck egg might break inside the bird. If the eggshell is thin or soft, or if the bird strains too hard, the egg can rupture. When an egg breaks internally, its contents spill into the abdominal cavity. This can cause a very serious infection called peritonitis. Peritonitis is inflammation of the lining of the abdomen. It is extremely painful and can be fatal if not treated aggressively by a veterinarian. This is why it is crucial not to try and squeeze the egg out yourself. The retained egg can also cause damage to the oviduct itself. Prolonged pressure can lead to tissue damage or even rupture of the oviduct. This can cause internal bleeding. It can also lead to infection spreading through the bird's system. If the bird survives the initial episode, such damage can cause future reproductive problems. Scarring in the oviduct might lead to repeated episodes of egg binding. The longer the egg remains stuck, the higher the risk of these severe complications developing rapidly. Without prompt treatment, a bird with egg binding can die within hours. The combination of pain, stress, internal pressure, potential infection, and shock is often too much for a small bird's system to handle. Therefore, if you suspect your bird is egg-bound, you must seek veterinary attention immediately. It is not a wait-and-see situation. The bird's condition can deteriorate very quickly. Swift action provides the best chance for a positive outcome and can prevent unnecessary suffering for your beloved pet. Section 6. Seeking expert help veterinary care for egg binding. If you suspect your bird is suffering from egg binding, the most important step is to contact an avian veterinarian immediately. Avian vets have specialized knowledge and equipment to diagnose and treat birds. Trying to fix the problem at home without experience can be very dangerous. It can cause more harm, such as breaking the egg internally. A veterinarian will be able to confirm if your bird is indeed egg-bound. They will also determine the best course of action based on your bird's specific condition. When you arrive at the veterinary clinic, the vet will likely start by gently feeling your bird's abdomen. This is called palpation. They are looking for the presence of an egg. Sometimes an X-ray might be needed to confirm the diagnosis. An X-ray can show the egg's size, shape, and position. It can also reveal if there is more than one egg or if the egg is broken. These diagnostic steps are crucial for planning the correct treatment. The vet will also assess your bird's overall condition, checking for signs of shock or dehydration. Initial treatment often involves supportive care to stabilize the bird. This may include placing her in a warm, humidified incubator. Warmth helps the bird relax and can sometimes help the muscles work better. Fluids may be given either by mouth or by injection to combat dehydration. Calcium supplements are often administered, usually by injection, as this can help strengthen muscle contractions and improve eggshell quality if another egg is forming. Pain relief might also be provided to make the bird more comfortable while her body tries to pass the egg. In many cases, supportive care and calcium are enough to help the bird pass the egg on her own. The veterinarian may also use lubricants gently around the vent area. Sometimes hormones like oxytocin or prostaglandins might be given. These hormones can stimulate contractions of the oviduct to help expel the egg. However, these are only used if there is no obstruction beyond the egg itself. The vet will monitor the bird closely during this time. The goal is to help the bird pass the egg safely and with minimal stress. Section 7. When more help is needed. Advanced treatments and guided home support. Sometimes initial treatments like warmth, fluids, and calcium are not enough. The egg may still remain stuck. In these situations, the veterinarian might need to use more advanced procedures. One such procedure is called ovocentesis. This involves carefully inserting a needle through the bird's abdominal wall or vent into the egg. The contents of the egg are then aspirated or sucked out. This makes the egg smaller and allows it to collapse. A smaller collapsed egg is often easier for the bird to pass. This procedure requires skill and precision. If ovocentesis is not possible or does not work, the vet might try to manually remove the egg. This is a delicate procedure. The vet will use lubrication and gentle manipulation to try and ease the egg out. It is very important that this is only done by an experienced professional. If done incorrectly, the egg can break or the bird's delicate tissues can be damaged. In some rare and difficult cases, surgery may be necessary. Surgery is usually a last resort. It involves making an incision to remove the egg directly from the oviduct or abdomen. It is absolutely critical that bird owners do not attempt these procedures at home. Trying to squeeze or manually remove an egg without proper knowledge can be fatal for your bird. You could easily crush the egg inside her, leading to peritonitis. You could also severely injure her internal organs. Always trust your avian veterinarian for these interventions. They have the training, equipment, and understanding of bird anatomy to perform these tasks as safely as possible. Your role is to provide support and follow their guidance carefully. After veterinary treatment, whether the egg was passed naturally or with assistance, your bird will need careful home support. Your vet will provide specific instructions. This usually includes keeping the bird in a warm, quiet, and stress-free environment. A hospital cage or a small brooder can be ideal for recovery. Continue any prescribed medications such as antibiotics or pain relief. Offer her favorite, easily digestible foods and fresh water. Monitor her closely for any signs of complications like bleeding, continued straining, or lethargy. Report any concerns back to your vet promptly. Section 8. Stopping trouble before it starts. Preventing egg binding. Prevention is always better than cure, especially for a serious condition like egg binding. A balanced and nutritious diet is the most important step in prevention. Ensure your bird receives a high-quality formulated diet such as pellets. Supplement this with a variety of fresh vegetables, especially dark leafy greens rich in calcium. Fruits can be given in moderation. Avoid an all-seed diet as it lacks essential nutrients. Provide a reliable calcium source like a cuttlebone or mineral block, especially for known egg layers. Always ensure fresh, clean water is available. Managing your bird's reproductive cycle can also help prevent egg binding. Some birds, especially smaller species like finches and cockatiels, can become chronic egg layers. Constant egg production depletes their body's resources. You can discourage excessive egg laying by controlling light exposure. Birds often breed when days are long. Reducing daylight hours to about 10 to 12 hours can sometimes signal their bodies to stop laying. Avoid providing nesting materials or cozy dark spaces if you are not intending to breed your bird, as these can stimulate nesting behavior and egg laying. Creating a safe and stress-free environment is also crucial. Stress can disrupt a bird's normal physiological functions, including egg laying. Keep your bird's cage in a calm area of the house. Protect her from loud noises, sudden movements, and harassment by other pets or small children. Maintain a consistent routine for feeding, cleaning, and interaction. If you have multiple birds, ensure there is no bullying or competition for resources. A happy, secure bird is generally a healthier bird, less prone to reproductive issues. Regular veterinary checkups with an avian vet are a key part of preventative care. These checkups allow the vet to assess your bird's overall health. They can detect early signs of nutritional deficiencies or other potential problems. Your vet can provide tailored advice on diet, environment, and managing egg laying for your specific bird. If your bird has a history of egg binding, your vet might suggest specific supplements or hormonal treatments to prevent recurrence. Being proactive about your bird's health is the best way to avoid the distress of egg binding. Section 9. Your bird's best life. A partnership in health and prevention. Ensuring your feathered companion lives a long, healthy, and happy life is a rewarding partnership. When it comes to preventing conditions like egg binding, your role as an observant and caring owner is paramount. By understanding the needs of your bird, you can significantly reduce the risks. Remember the cornerstones of prevention. A well-balanced diet rich in calcium and other vital nutrients is fundamental. Move away from seed-only diets and embrace species-appropriate pellets and fresh foods. This simple change can make a world of difference to her reproductive health. Creating an optimal environment also plays a huge part in your bird's well-being. This means providing a spacious, clean, and safe cage. Ensure she has opportunities for exercise and mental stimulation. Minimize stress by maintaining a consistent routine and a calm atmosphere. If your bird is a female, be mindful of factors that can trigger excessive egg laying. Controlling light cycles and avoiding nesting stimuli can help manage her reproductive drive. Your vigilance in these areas contributes directly to her physical and emotional health, making her less susceptible to problems. Being a keen observer of your bird's daily behavior and physical condition is another critical skill. You know your bird best. Notice subtle changes in her appetite, activity level, droppings, or posture. These can be early indicators that something is amiss. Early detection of any health issue, including the initial signs of potential egg binding, allows for prompt veterinary intervention. This swift action can greatly improve the outcome and prevent minor issues from escalating into serious emergencies. Trust your instincts if you feel something is not right with your bird. Finally, always remember that your avian veterinarian is your best partner in your bird's health care. Do not hesitate to seek their expert advice and services. Whether it is for routine checkups, dietary counseling, or an emergency situation like suspected egg binding, their specialized knowledge is invaluable. By working together with your vet and by committing to providing excellent daily care, you can help your beautiful bird avoid the pain and danger of egg binding. The joy and companionship these intelligent creatures bring to our lives make every effort worthwhile.